HealthCare is one of the many essential occupations working throughout COVID-19. Just like everyone else, they too have adapted to the change.
We would normally see people 100% in person, but once everything shut down, our clinic is kind of a place where wellness visits and physicals and things, and nobody wanted to come in, and so everything was shut down. So we went from seeing, let's say, 20 patients a day per provider to nothing.
Before COVID happened, we had all inpatient visits with the rare video visit. When I say rare, I mean really rare. Maybe one every 6 months or every couple months. And then COVID happened and we did a lot of things via telephone. And then it slowly ramped into a lot of video visits and telephone visits.
It took some getting used to. So once patients became comfortable with setting up the app on their phone or the computer, and we have a pretty old population, elderly population, so their family members had to help them set that up.
And now, as things have kind of settled down a little bit, we're doing a lot more live visits.
So in the beginning, with the rise of COVID-19, more of our workload was sent to the urgent cares and the emergency rooms, obviously. Here at our clinic, people just didn't want to come in for basic care, basic blood work, basic things. And so we saw actually a period of time, a month or so, where our numbers were really low when the COVID infection was so high.
I think that a lot of people have been avoiding coming in. So there's been a decrease initially in maybe when somebody should have come in from when they actually did come in. I don't feel risky because we have all of our PPE that we wear whenever we see patients and whenever we see anybody that we have any suspicion of anything. So in that regard, I don't feel at more risk. I think that people are at more of a risk when they go to the grocery store than coming to the clinic.
There were a lot of challenges we faced at this clinic in particular. Initially, we did have somebody within our clinic exposed to COVID, and so members of our staff needed to be quarantined for several weeks at a time. And so while we weren't busy with a lot of patients here, COVID definitely affected our staff and our life here. The idea of wearing a mask every day and coming into work knowing that we could be exposed to it just through talking with one another or seeing patients was very scary. At that time, we were on guard or on radar to be redistributed to those facilities. They were going to send me to a hospital or to a tent that they had set up as a way to help with numbers, where all the patients were actually congregating because they were so sick. So here we weren't as busy for about a month, but now we've picked that back up. So I would say in the beginning, the world changed and the job changed, and suddenly everything was scary. But then once things were figured out a little bit, it was easy to get used to the new routines. To be one of the essential workers that has to go to work or did go to work in the beginning, I had a lot of emotions about it. On some days, I just wanted to stay home like everybody else was doing. And on other days, I needed to leave my apartment just to get out of my own space. So depending on the day, I had different opinions about it, but in the end, I would say I was happy to have the opportunity to keep working every day. I got to see my coworkers here and engage in what we normally were doing, which was distracting. So.
As COVID-19 continues to impact the world, those with essential jobs fight the virus head-on by helping keep our society functioning.
I think it's funny for people to be considered essential or non-essential based on this one virus. I think everybody's job can be really essential, and obviously it's essential to their livelihood. So sometimes I struggle with that discrimination between somebody being called essential and somebody not being called essential. Obviously, they're trying to support themselves and their life. Simply because being, let's say, a restaurant worker or a setup crew for a concert venue isn't essential doesn't mean that their job isn't purposeful and contributing towards society. So I think that's a hard definition.